Massachusetts residents are all too familiar with the Affordable Care Act. After all, our own state's insurance plan was the blueprint for it. Ever since its passage, it's been a political football under the threat of repeal. So far it has survived, but people are still unsure about its future. The group Health Care for All held a forum at the Duxbury Senior Center to give everyone an update on the status of health insurance here in the Bay State.
My organization is called Health Care for All, and we work to improve healthcare in Massachusetts. And we think there's some real opportunities going forward to make the mass health system work better and to provide more help for people with high copays and high deductibles. Healthcare's been in the news lately with the defeat of President Trump's healthcare plan. We want to give an update as to what's happening, particularly here in Massachusetts, with our healthcare system in Massachusetts. So as you know, we have the Romney Care plan that was passed 10 years ago, and that influenced the Affordable Care Act, the Obamacare law, and so we want to give an update here on what's happening now. It worked in Massachusetts. You know, we were the example of right-wing ideas and left-wing ideas, like the employer coverage, like the Medicaid expansion. Those ideas actually came from my group. And what President Obama did is what Romney did, is sort of meld right and left and try to find a pragmatic way of moving forward. And the proof is uninsurance rates dropped to half of what they were before. In Massachusetts, we have about 2.5% uninsured. So we're doing pretty good. First of all, people are going to want to know about the politics, what just happened. How was the plan defeated in the House of Representatives in Washington? When it was a Republican plan, there's a Republican majority in the House and the Senate. So we can talk a little bit about the politics. I'm particularly interested in how people get coverage in Massachusetts and what are the ways of increasing coverage. You know, we're the best state in the country for getting people health coverage, but we still have a lot of challenges, and healthcare costs in Massachusetts are still going up very fast, so we've got to do something about health costs. There's a lot of energy among single-payer supporters following the defeat of the bill in the House last week, but it's hard to see that really going forward, given we have a Republican president. So it's certainly something that my organization supports, although it's not something we spend much time working on. So my message tonight is, one, how the Republican Democrats came together to pass first Romney Care here in Massachusetts, and then Obamacare, which is based on the same thing, but that was totally partisan. And second, what's the future for healthcare in Massachusetts? Are there some new ideas where we can make more progress?